Spoon and syringe feedings are other simple methods for supplementing newborns if needed. Simply support the infant upright in your lap as you would for cup feeding, offering small amounts of milk. We look to the infant to pace and swallow at his or her own pace. As with all infant feeding, we look to the infant for feeding cues and avoid pushing milk into a sleeping infant's mouth. So we will certainly assume that the infants in these pictures are simply resting their eyes and not actually sleeping. A useful way to introduce colostrum to a newborn who is not feeding well directly from the breast is by expressing drops of colostrum and offering to the baby by spoon or syringe so no drops are lost. Cup, spoon, or syringe feeding are all effective techniques for supplementing infants without interfering with breastfeeding technique. All of these options are appropriate for short-term supplementation, such as when an infant hasn't yet learned to latch at the breast or is having trouble with nipple confusion. A lactation consultant can work with the mother and baby to help the infant to learn to suck effectively at the breast. Cup feeding is an evidence-based practice that is also an effective feeding alternative in the event of bottle refusal. Benefits of tube feeding at the breast versus immediately supplementing with a bottle are that babies learn to breastfeed by feeding from the breast, and mothers learn to breastfeed by feeding from the breast as well. The mother's milk supply is stimulated by the infant sucking at the breast. Tube feeding at the breast involves the use of a container or bottle and a tiny tube leading from the container to the mother's nipple. This can be used to supplement with expressed breast milk by the mother, human donor milk, or infant formula. The infant receives nutrition directly from the breast in addition to the tube. Tube feeding at the breast is most appropriate when supplementation is expected to continue for several weeks or more. Originally, this feeding system was created for adoptive mothers who wished to share in the breastfeeding experience with their new babies. And now it is used in several special circumstances, such as infants who are not able to transfer milk efficiently due to weak suck or other physical challenges, or moms who have an insufficient supply due to such as breast surgeries. It is also so important to remember that breastfeeding is about so much more than just nutrition. It creates a bond between mother and child and provides comfort to the baby. A board-certified lactation consultant can evaluate the need for tube feeding at the breast, help determine which system to use, and provide guidance on usage and improve effectiveness. Paced bottle feeding is a technique designed to mirror the gentler rhythm of breastfeeding when it is determined that bottle supplementation is the best option. Hold baby upright for the feed so that the bottle is held horizontally. This prevents gravity from doing most of the work, and baby actively sucks to drink milk without having to chug. Using a slow flow nibble, allow the infant to take short breaks. Tipping the bottle down every 30 seconds or so helps mimic how the baby pauses at the breast. Simply keep the nipple in the baby's mouth and tip the bottle down to slow the flow, and back to horizontal when the infant starts sucking. It is very easy to overfeed babies with a bottle and tempting to encourage them to finish. If the baby is not actively sucking, is falling asleep, or dropping the bottle out of his or her mouth, it's time to end the feeding. In conclusion, there are a variety of safe and effective ways to supplement a newborn baby. And of course, there are pros and cons to all the supplementation methods. For instance, cup feeding is a simple evidence-based practice for supplementation. However, because it's not the norm for many of us, it can seem unfamiliar and challenging to avoid pouring milk too fast or spilling. But a pro, of course, would be how simple and easy it is to clean the cup. No matter what the supplementation method, it is important to look for infants' feeding cues and allow the infant to pace his or her own feed. And tube feeding at the breast can take a significant amount of time and education before the mom feels like she has the hang of it. For instance, the timing, the rate of flow, the tube placement, and the cleaning can take some hands-on work with mom before she feels confident. Please keep in mind that an IBCLC is also available to help support mom and infant, but we recognize that you play a vital role in helping these mamas feel confident and getting them off to a good start feeding their baby. Thank you.